and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
That's right, Bob. In our opinion, of course.
That's right. And our opinion is always somewhat correct. Today, we're going to talk about simple strengthening exercises for painful knees using a set of stairs. Voila. Arthritis or osteoarthritis. These work out really good for this because a lot of people have stairs, Brad.
Right.
They don't have to buy any equipment unless they want to add like some weights to this after a while. But it's a great way to do correct so you don't injure the knee more than it is already or make it hurt more than it is. All right, we'll get into that.
Right, and it's true. I can't tell you how many times I asked, do you have any stairs in your house going up to the upstairs? And it's nice, especially if they have two handrails to work with these.
You'll see why that really comes into play here. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, join us on our social media platforms because, once again, I can't even see, but we're at Instagram, on Facebook. Join us on Facebook. You can actually see it on YouTube here down below. We are doing a giveaway again. We're going to do a giveaway every week, but this week we're giving away the SleepOvation mattress.
Yeah, they are really nice mattress, very high end. As a matter of fact, I just got one in the mail yesterday at my house.
Oh, nice.
Yep. We're having guests coming over, and we want to make sure they have good.
They got the good comfort. Yep. And they'll come. There's some reason to visit Brad now.
Yeah.
Before there wasn't any.
Well, my wife.
Yeah, that's right. True.
She's pleasant.
Yeah, we got to find somebody in the house. Okay, let's talk about it. First thing, Brad, I want you to follow 3 rules when you're doing exercises with painful knees.
Sure.
1, you're not going to want to bend your knee more than 90 degrees.
So not deep squats.
Yeah, it's a right angle is 90 degrees. And ideally, to start, you probably don't want to even go past 45 degrees. And the reason that is, this is 45.
Right.
About halfway between a right angle and straight up and down.
Sure, looking at the knee.
When you go past that, you're starting to grind the cartilage. You got the cartilage in your knee. I don't know, can we see this on him or not? We're doing this spontaneously, but you got that's the cartilage right there. And when you go past the 45, you really start to put pressure on that cartilage. How are we doing, Liz?
And typically, you're going to feel it. It's going to hurt. Let pain be your guide with these as well. It's really
very
important.
Good, Brad, because that, no matter what we say, if it hurts when you're doing this, you can't do these.
Right.
I mean, you got to back off and do something less.
It's not a no pain, no gain philosophy. It should not be hurting.
So that's rule number 1. Rule number 2, and we want to show it using the Booyah stick.
Sure.
I don't want the knee to pass the toe whenever you're bending the leg.
So what he means is if we have a vertical line on the toe, and as you go forward, we don't want that knee going like that. We want to get to here, and then you're going to drop down here. And that's where you use a handrail or use the stick. And it's nice to have for balance. If you have a painful knee, I've had people drop down and they hit that painful spot because they went too far. I wasn't cautious enough with them. And I had one lady, it's like she went down. I mean, she didn't get hurt, but it's like, I grabbed her and it's like, so be careful.
Because the knee is weak.
Right. You need to be cautious. So, take your time with these.
And the last rule is that the bottom bone here, the tibia and the fibula, we've got a piece of tape on here, on Brad's. You don't want that to go in or out, because if it is, you're putting stresses on the knee. On this case, you're putting stress on the medial compartment here. In this case, you're putting stress on the lateral compartment. You don't need to know that. All you need to know is this needs to be straight up and down, straight vertical.
Yep. And so, I always tell, just look at your kneecap. It should be in line with your toe if you're lined up here. Usually people have a tendency to do this direction, but not always.
Especially women, a little wider hips, a lot of women.
Right.
And that's how they tend to get injured too in volleyball and stuff like that.
It has to do with the Q angle, but we don't need to get into that.
Right. So let's talk about the first one, Brad. You have a set of stairs, and it's nice, again, if you have 2 railings. But you can just start off by doing some squats, and you can do it a progression here. So what's nice is you can hang on to the railings, and I can do some shallow squats. I'm keeping my knees back behind the toes. I'm not going in. I'm not going out. I'm just starting some squats. And depending on how your stairs are shaped, you might even be able to take your butt down to the stair in case you lose your balance.
Sure.
I mean, you could just drop onto the stair and not worry about it.
Right.
So you can start doing these squats. You can keep in good position body back wise and work it that way. Now, if that gets to be too easy, you can go with one handrail,
right.
and maybe you only have one handrail.
And sometimes if they only have one handrail, have them take a stick or a cane, and they can use that in one hand and the rail in the other.
Yep, exactly. Or they can progress to the one, just going with the booyah stick or the handrail. So and then finally, you can actually add some weights. Brad, do you want to? I brought purple to match my outfit today.
Yeah, and he happens to be a Viking fan, but we don't hold that against him.
And they had such a good year. Okay, so again, you can do that, or you can keep them up here, wherever you feel most comfortable here, but you can start doing some squats.
By the time you get the weights, your pain in your knees, you should be feeling pretty confident. It should not be painful. This is more towards the end of your rehab.
Exactly. So the next one we're going to do is actually what we call lateral step-ups. And these work out really well on a step. So I'm strengthening this one right here.
Sure.
So I step up to the step, and this railing here prevents my knee from going too far.
Right.
So it keeps you honest, basically.
Sure.
And you can use the railing if you need to, and you can step up like this. And it's just doing little step-ups like this. And this may seem really easy, but on a higher step, and if your knee is weak, this is probably one of the better ones for you to start.
And also, you don't want to have, if there's a wall there, that keeps you from leaning forward and cheating that way. So, the wall would be here. Show them what sometimes people compensate.
Well, yeah, they want to go like this.
Yeah. And then that's not proper either.
So in the next step up would be
no pun
trying
intended.
with no railing at all and trying to work this way. And you want to try to slowly go down.
Right.
Don't try to go too fast. And these are a little harder after a while than you think, Brad.
What I do with this, when people get good, I say, pull your toe up and just let your heel touch.
Oh, sure. So you're going like this.
Yep, and then go down just the heel touches, and then pretend there's an egg underneath your heel, so you just touch the floor.
These aren't that easy.
Yeah, it gets much harder. Don't use that for balance, but that's for advanced.
I swear my legs are pretty strong. I thought they were. Yeah, that is more advanced. And then, of course, you add weights to that.
Right.
And it's going to really start getting tough.
Right. It is amazing how little things, if you do them properly, you can really have some pretty tough exercises.
Well, you're right, Brad. I'm actually starting to feel it here.
Yeah.
And again, this is a short step.
Yeah, we're about 6 inches there.
So, all right, next one, let's just flip it around here, Brad. I like this one too because
well, it reminded me of those shows like
Yeah, I know what you're talking about. Somebody at least does. All right, so we're going to do a step up here on this one. And what I like about this, again, you can use the rail or one rail, and you step up, and it's really easy to keep the knee back behind the toe. And with this one, now you're getting into the hamstring a little bit, and the glute max, and so you're getting some of the muscles behind the knee too, not just in front of the knee.
It's very functional, obviously.
Yeah.
When you get better, you're going to be going up and down steps, maybe doing some hiking up and down some hillsides, etc. And notice I got the stick here, so it keeps Bob. You want to keep that posture upright as opposed to leaning forward and cheating or compensating, as we would call it.
And I'm doing the same thing you had recommended, Brad, where I go up and now I'm just touching my toe and coming back up again.
Sure.
And now you're starting to feel it. I mean, and if I go to 1 and if I go to 0, it's actually very difficult. I mean, when you start getting that one leg, and again, you don't want the leg in or out. You want it straight forward, like Brad said, the knee going right up over the toe.
Right in the middle. So obviously we're going through a pretty progressive rate of exercise from simple to when it's painful and weak. And these last ones, it may take weeks to get to that point.
Yeah, I mean, if you get to the point where you're using like double weights and you're doing step-ups, I got a feeling this is not going to go well. Actually, it went okay.
Okay.
So, again, that makes a big difference.
Right. So you'll know your judgment. If you're an athlete, you're 25 years old, you might be, using heavier weights or even one of the next exercises.
Yeah. Why don't you show the next one, Brad? You do these on a couple times a week?
3 times a week.
3 times a week.
The Bulgarian
split Bulgarian.
Split Bulgarian shuffle.
I don't know what the shuffle part is.
Just kidding. So you put one leg back here.
We didn't know it had a name. It's the split Bulgarian.
I usually use a stick, the way a stick with mine, because I like it for balance. I see people doing it without a stick and with weights.
So which one are you strengthening, Brad?
The front one.
Yeah.
And you're getting some of the back when you're getting a nice stretch on the hip flexor on the back leg, which gives it, it's like a bonus. And I'll do this. I'm looking to make sure my knee is in line with my toe, not right or left. And I'll go down to about 90 degrees and up. And I'll do 3 sets of 10 on each leg.
And again, if it's problems, if it's problematic, you could go down to 45 degrees.
Sure.
Knee angle. You wouldn't have to go all the way down.
Right. If you want to use weights, a good posture here. And
do you use weights?
No, I don't. But maybe I should. I don't have any weights. I don't use any weights.
Sure.
I use all bands, and I use a stick, and I use a ball. And I like the benefits from that. But maybe I'll get into weights someday.
All right. Well, we'll be waiting with bated breath, Brad. Okay. By the way, if you're new to our channel, we already said that. If you, we can fix just about anything. That's what I was trying to say.
Oh, good. But Bob, it's snowing outside,
yeah,
so this is a good sign, except for a
broken heart. We can fix just about anything except for a broken heart. We really messed that up, Brad.
Well, I know, but that happens with age.
We do everything live, so it's we don't edit anything.
Things happen.
Yeah. All right. Thanks for watching.